Melissa here, everybody, and today is a special episode where we're going to be covering self-myofascial release techniques utilizing a ball and a foam roller. So why is myofascial release important? When we think about the pelvis, we have over 36 muscles that attach to the pelvic bones. And when we utilize something like a foam roller or a ball, we're indeed supporting muscular massage of these structures, but we're also impacting our fascia. So what is fascia? Fascia is a web-like structure that encases our nerves, our blood vessels, our muscles, our ligaments, our bones, our organs, and really helps to support the positioning of all of our internal structures. And we can develop restrictions in our fascia for a number of different reasons. Poor posture, prolonged sitting, any kind of injuries or scarring in any certain areas. And those are just a few of the ways that fascia can become restricted. And in order for our muscles and nerves particularly to be happy in a moving and sliding, gliding environment, we need the fascia to be also moving, sliding, and gliding well. So how do we do that? We compress the fascia. So we can think about fascia like a sponge. When we compress it, it then opens up and is able to accept more water content. Similarly, when we release compression, we're also welcoming in new blood flow, which helps to facilitate that hydration and also facilitates nerve healing. So these are important techniques for folks working with pelvic health conditions. And before we jump in with our foam roller and our ball, I want to give us a quick anatomy review so that we can properly use the props. No pun intended. So here's a pelvis model that we can take a peek at. And when we think about our hip bones, when we place our hands on our hips, we're really placing our hands on the top of this bone here, which is called your ilium. And this wave-like structure is called your iliac crest. So that's a landmark that is important because your glute muscles attach at the back of your iliac crest. So we'll talk about that once we're on the foam roller. Another landmark is going to be your sacrum bone, which is at the base of your pelvis. And then finally, we have our sit bones here, which we can feel when we're seated on a hard surface. And those three landmarks on the pelvis are going to help us to get a sense of where we are when we're utilizing our foam roller and our ball. Finally, a structure that isn't on the pelvis but is actually the hip bone itself is going to be another landmark that is helpful to be aware of. So our hip bone is simply that bony prominence right here that we can feel on the outer hip. And sometimes we have to dig for it, but indeed that lateral hip is our outer hip bone, also known as our greater trochanter. So those are just some anatomy tips for as we go along today. So go ahead and grab your foam roller and your ball, and I'll meet you on the mat. So we're going to start out with the foam roller, and we're simply going to sit on the foam roller and start to roll out our glute muscles, also known as our butt. So once you take a seat on the roller, you want to think about actually shifting your weight. So initially we're right in the middle. That can be kind of uncomfortable right on the sit bones and in between the tailbone as well. So we want to actually shift our weight to one side so that we're really just working on one side of our glute musculature. Initially, as a lot of folks are probably aware of, when we foam roll, the tendency is to roll back and forth. And this helps make the technique a little bit more tolerable, right? Foam rolling can be fairly intense. So let's bring in the yoga piece here and talk about diaphragmatic breathing as we do the foam rolling techniques. When we're first starting out with foam rolling, it can be pretty intense. So the body can react to that intensity by getting a little bit of upregulation in the nervous system because it's a little bit ouchy. So if we utilize really nice deep diaphragmatic or belly breaths as we foam roll, it's actually going to help downregulate our nervous system and increase the likelihood that our muscle tension is going to leave the body. So whenever you work with any myofascial release techniques, especially the more intense they feel, it's important to breathe deeply into it. Now, we also want to be mindful of any pain points. So it's not necessarily to work into an intense myofascial technique if it's just causing pain. So that's going to be another yoga piece of really just starting to develop an awareness of what your tissues are okay with and what you can work through versus what just feels painful and like a structure that you don't want to be on. So that's something that might take a little time to develop, but the more you can get curious about these techniques, the more likely you are to develop that awareness. So keep that breath flowing, and we're thinking about rolling out our glutes here. Now, the more pressure you apply through your hands and your feet, the more you're actually going to kind of lift and alleviate pressure from the glutes. So that's one other way to make this a little bit more tolerable. Now, if you need more and you're looking for more pressure, you can actually kind of lift your legs up off the floor, and that's going to cause gravity to drive more weight right through that glute tissue. So right now I'm in between my outer hip bone and my sacrum, and I'm accessing really more of the piriformis musculature, which is a deep stabilizing muscle in the pelvis that tends to get a little bit cranky. If we want to roll the higher portion of our glutes, we're actually going to take the foam roller more to the top of that iliac crest or the top of our hip bone. And you can even come down onto your forearm for this technique to get a little bit more into the outside of your hip. You might even want to shift your leg positioning so that you can be a little bit more on your side, and that's going to give you a little bit more of a chance to access your glute med here. So this is another way to kind of just get the full exploration of all of the hip musculature so that you can roll out throughout that entire posterior hip. All right, so glutes are check. Glutes are check. We're finished with the glutes. We're gonna move on to inner thighs. But before we move on, I do wanna encourage you to always foam roll on both sides of the body. And that's again gonna help you develop awareness around which side of your body needs a little bit more TLC and attention as you work into these techniques. So next we're gonna work with the adductors or the inner thigh muscles using the foam roller. And we're gonna start by coming onto our belly. So go ahead and come onto your belly here, and you're gonna wanna bring one knee up towards you, and you're gonna bring the foam roller underneath your leg in a perpendicular fashion. So of course, one way to roll out the inner thighs is back and forth along the muscle belly. Now, being a little bit cautious when you get close to the knee, it's not gonna feel great because there's more ligamentous structure there. So I would suggest really focusing the foam roller into the middle of your muscle belly. That's also where trigger points tend to develop. So the more you can focus the compression in the middle of your thigh, the better. And of course, kind of working along the length of the muscle belly, coming a little bit closer to the pelvis. There's a couple different adductor muscles that are closer towards the pelvis that we also want to make sure we address here. So of course, rolling back and forth is one way to get that compression and make it a little bit more tolerable. With all these techniques, you can certainly be static and just focus on your breathing to help really melt the muscles into the roller. Another way that we can get some of that compression and release is actually active movement in the rest of the leg. So what I'm going to do here is I'm going to extend my leg straight and then bend it. And simply working with this along different parts of the muscle belly can give me just a little bit compression and just a little bit release as I work here. And we're breathing deeply. Excellent. So those are foam roll techniques for the hip musculature as well as the inner thighs, which are two muscle groups that tend to develop trigger points and refer pain to the pelvic floor. So these are helpful techniques for a lot of different types of pelvic floor conditions that you might be working with. Another tool we want to think about using is a ball. So a tennis ball is a great place to start. It's accessible to a lot of folks and it has air in it, so it has a little bit of give. Now, the market is flooded right now with a lot of self-myofascial release balls, all of which have varying densities. So something like a lacrosse ball even is very, very hard and going to be more intense, whereas something like a tennis ball or a soft myofascial release ball is going to be a little bit nicer on the tissues. So just keep that in mind as you work with any kind of ball technique. So when we think about rolling the glutes out with the ball, the most tolerable technique to start is actually going to be utilizing a wall. So let's have a little demonstration here where I'm going to bring the ball. Initially, we're going to start with piriformis. So I'm getting my hip bone awareness, my sacrum awareness, and I want to place the ball really right in the middle of the buttocks tissue there, and that's going to be more my piriformis. Then I'm going to pin the ball in that same spot between me and the wall. Now initially we can just kind of do a little wiggle, see, okay, where am I? Does that feel right? and that's where your starting point is. Now, the more you walk your feet away from the wall, of course, the more pressure you're driving through the ball. So that's going to be a little bit more intense, but you have quite a bit of control in this position because you can decide how far away your feet are from the wall. So with this technique, we can certainly move with a little bit of wiggling, a little bit of circular motion, as well as a little bit of side-to-side motion, and really just deciding if there's any spots that feel sticky or uncomfortable that we can then breathe into with really nice long exhales to help the nervous system relax as we work into these muscle techniques. Again, working side to side and just checking out, okay, which side is feeling a little bit more sensitive, and maybe being a little bit more gentle on that side. So this is one way to work the glute musculature. Again, if you want to work into that piriformis, you're more right in the center of the buttocks tissue. And if you want to work more into the glute med, then you're more high around that iliac crest. Okay? So if we want to increase the intensity of this technique, we can certainly utilize gravity as an assistant, where we're actually going to be sitting on the ball. So you want to use the support of your arms and your legs for this to help decrease that pressure through the ball. But really, you're pressing into your arms, you're supporting your lower body with your feet on the floor, and then you're applying that pressure through the glutes to explore the technique here. And again, kind of just getting curious, okay, I feel my hip bone, now I'm going to work up a little bit more towards the glute med, maybe come onto my forearm to get into the top of that glute med at the iliac crest, or maybe coming a little bit more central to that piriformis muscle in between hip bone and sacrum, okay? So that's another way to roll the glutes here. So those are two different props or tools that we can utilize to encourage self-myofascial release and hydrate our tissues. Again, utilizing that deep diaphragmatic breathing is going to be a really important component of this that sometimes can be missed. And if you want to know more about why this deep diaphragmatic breathing is important, be sure to check out our Mindful Monday practice from this week, where I dive a little bit deeper into how the deep diaphragmatic breathing is impacting your nervous system as well as your muscles. So go ahead and check that out. Thanks everyone for joining me today for this special episode where we looked at myofascial release techniques using a foam roller and a ball, and I'll see you next week.